All right, everybody. Hey, thanks for coming. Treatment planning and imaging is something that we do every single day. And I was hoping that I could just share a couple of things to make life easier if possible. Because days are crazy. So I'm hoping that we can just make things better. That's what I wanted to share. I'm going to talk a little bit about who I am in just a second, but let's just do a little intro poll. So we have a number of polls tonight. I thought it would be better, and if I don't really just like to talk. I do a lot of lecturing, but I much prefer having it with people interacting so I know what I'm talking about and who I'm talking to. So I'm hoping that we could do some interactive polls here. We just got one to kick us off. Number one, how confident are you in your current imaging workflow during case presentations? Not at all confident. Let's hope that's not very many. Somewhat confident, very confident, or I just find it frustrating. I'm hoping that even if you're wanting to get better, I'm hoping you're still confident. So just curious where people are at here with treatment planning and giving case presentations. And let's see where we're at. Okay. All right. I think everyone's seeing these with me. Um,
That is correct.
okay. Thank you. So somewhat confident is the majority of the people by a long shot. Some people find it frustrating, but yeah, that's great. I would probably even put myself somewhat confident, but I hope that through this process we could become even more confident. All right. So, so I'm Dr. Greg Gillespie. I'm the one on the left. I work with my brother, Dr. Brad Gillespie, and my cousin, Dr. Dennis Gillespie, and we are Gillespie Dentistry. I practice in Vancouver, Washington. Um, I've been practicing for about 20 years, and we have grown the team. We took over for our dads. It was small, and then we started to grow a little bit more, a little bit more. I do cosmetic dentistry exclusively at this point. My brother, Dr. Brad, does all implants, surgical, anything surgical. That's what he's doing. Dr. Dennis does snoring and sleep apnea exclusively. I'm also the only one who's IV certified in the practice, so I also do wisdom teeth and all the IV sedations. So that's a little bit about us. This is how big our team is. It's huge. We actually just expanded to 37 employees. So maybe we could talk about just how to manage a practice afterwards. It's a big job of mine, but getting all the team on the same page about a number of things that you're doing is really, really important. And in treatment planning, it's no different. From those who are coming in for the financial portion of the treatment plan, the assistants who are helping you gather the imaging for the treatment plan, putting it together, having it feel seamless, having your patients feel like, oh, these guys have it going on. They know what they're doing. That component is really important. That the team and you and the patient are in sync and it feels cohesive. So working on that as a team is something that we do actually a lot. We work on the how we're going about treatment planning. How do we make it easier? How do we make it more seamless? Presentations, where we're doing it, how we're doing it. So we work on it a lot. So I'm happy to just share some things that we're doing to see if we can make it a little bit better for everybody. So again, I'm a general dentist. I've been practicing for 20 years this fall, which is hard to believe, but that's how it is. I said I was a cosmetic specialist. I've been lecturing for about 15 of those 20 years, and I lecture on a whole bunch of different things. Mostly, I'm lecturing about cosmetics at this point, but I've lectured about adhesives for about 10 years. So we could talk a little bit about that if you wanted to, but also team dynamics. I love trying to get the best out of a team. And so I talk about all those different things. A couple of things, just so that you know, I am receiving an honorarium for the CE, but I'm not an employee of any company, Dexis or anyone else. And all the cases that we're going to talk about are just my own. And so you can laugh or cheer or however. All right, let's go with the first official poll. Let's see what we got here. Okay, what type of imaging do you rely on most during initial patient consultations? 2D images. If you don't have a pano or a cone beam, I guess that would be it. Intraoral photography, intraoral scans, or a combination of those. Okay, so curious where you fall. If there's one thing that you're normally using, I'm definitely on a combo basis here. And I actually like to use everything. I like 2D, panos, 3D, photography, scans. I think the more information, the better. It's just making sure that it's presented in the right way. Okay, let's see what we got. Oh, well, this is why I asked the question. Yeah, a lot of people just talking about 2D images and maybe just some intraoral photography. Not okay. And then a combo. Yeah, a combo of multiple. All right, well, let's get into it. So I will tell you, I've been working with a number of different imaging platforms, obviously over the 20 years, and nothing makes me more frustrated than having to have different windows for my cone beams, my intraoral scans, my 2D images, my um, photography, like trying to pull up the different windows and scroll through things and bounce back and forth. That is just that is just such a headache for me. That is actually my number one pain point is the multiple windows. That is just what gets me every time. And that's why I was always looking for a solution was when are these companies going to put the 2D and the 3D and intraoral scans all in one? For a while, some of them were 2D and 3D. You could get some of that. That was the first kind of breakthrough is when you could have a 2D imaging system and a 3D imaging system in the same window. But it's hard because not every clinician wants to buy the cone beam that works with their sensors, right? Their 2D sensors. And so some cone beam companies weren't playing nicely with the 2D imaging. And so you couldn't put them together. And so then it was forcing the hand of a doctor to be like, well, I really like this cone beam. And so I'm going to get this cone beam. And then they're going to just deal with it. And that's the way I did it for years and years is that I had my cone beam imaging in one window and then I pull up my 2D imaging on another window and I kind of try to bounce back and forth. And then I'd have my intraoral images kind of with that. But then when I got an intraoral scanner, you guys, this is what I was doing. I had my 2D images on one window. I had my 3D images on another window. I'd pull over my iTero and I have my intraoral scan on another, like another imaging device. And it was a mess. And still sometimes it feels, unless everyone's dialed in, that it can be frustrating. So that's really been an issue for a number of companies as well as a number of doctors is can we get all of the images to play together? And that is still something that is a big hindrance out there is can we get all of the open architecture to truly be open? I remember the first time I was told that it was open architecture and then I tried it and I couldn't get anything to sync or it was very difficult. They're like, no, you can do it. Just take 7 more steps. Let's see, I drag this one, put this one in, and then you can do it. But it was really frustrating. All right, poll number 2. I'm curious where your frustrations lie. Let's see what we got here with poll number 2. All right. This one here, we have your biggest challenge when using imaging for treatment planning. Is it switching between multiple imaging platforms like I was talking about? Presenting images in a way patients understand? I mean, that could be some of it. Integrating 2D, 3D photos and scans seamlessly? Yeah, that is super frustrating. Training my team to use imaging effectively, which can be an issue. Sometimes the doctors know more and sometimes only the assistants know. Cost of upgrades or new tech? Yeah. Or you don't really have any problems. Let's see what we got. Oh, across the board. Look at that. Okay, frustrations all over the place. Absolutely. Although I do like those 2 people that don't have any problems. Thumbs up to you. That's great. Yeah, cost. Totally. Presenting in a way that patients can understand. Yeah, absolutely. Okay, let's see what we can do. So, the major players right now in imaging, DS Core is, they continue to evolve and they're a fantastic ecosystem if you are Serac heavy and you send a lot to a lab, and you're using all DS, Dentsply Sirona, you're using all their imaging, then it works well, right? If you're in that ecosystem, that's good, especially if you're Serac driven, you have to have that. Remexis from Planmeca, they're very powerful. It's a very powerful program. It's not quite as user friendly. It's very robust, but you can do a lot there. It's more like an engineering, right? Like you have a lot of options at your disposal. Curve and Soda are the two of the cloud-based imaging platforms, which I mean, I would love to go cloud-based. I'd love to go cloud-based. That's that's one thing that draws me towards both of these is the idea that I can have it cloud-based, always backed up. But when it's cloud-based, then it struggles from what I've heard from some of my friends. I don't use Soda yet, but overall they say it's great, but sometimes getting the imaging to come back and forth, it's not as robust. You can't quite plan as much at the same time. So there are some issues there with the cloud portion, but I'm sure that's only going to get better. I'm hoping everything moves to the cloud. Right now, I can't believe how much I just paid for a new server. So, right, having a server that's big enough and having all the computers that are robust, right? That's another thing. When it's in the cloud, it's nice because almost any computer you have works because it's working off of the internet versus something that's robust enough to do all of the planning. For example, in our office, we just built a new practice. We have 22 rooms, and not every room can do the same thing as far as the planning is concerned because I'm not always planning full implants and hygiene. So like some of our computers aren't as robust as some of our other ones. So there's an issue there about having computers that are going to be robust enough to do all of the planning. Um, and the other thing that's really throwing a lot into this is now AI, right? AI is the future of imaging for sure, right? Like jump on because it's happening. And AI is now driving all of these softwares because AI can start reading things and starts to pick it out and it knows before you need to know, right, what it needs to be picking up. It's picking up all these things and it's just getting better and better and better. With each version, they're getting better. I love how quickly the updates are coming out, right? Pearl was one of the first ones to come out about caries detection and like 2D imaging. Finding that out, it was so exciting. I can remember the first time I looked at it. I watched a little YouTube clip on it because I was so excited and I was just intrigued by the colors and it's been so good. Overjet is also good. The Videa Health, that's I think with Soda Cloud, that's working. And some of the other ones like Romexis and DTX, Studio Clinic, those are powered internally. They have their own AI programs that are running it. So some imaging systems partner with third-party AI companies and others are internal. I think there are advantages and disadvantages to both. Um, AI is always working, and sometimes when you're just an AI company, then you're pushing that to get better and better. And sometimes it can be a little bit slower with some of the bigger companies. But I will say one of the things I've been very impressed about with DTX, I've been working with them for a number of years, is I've been shocked at how quickly those new versions come out. I know on Planmeca, they're on Series 7, and DTX Studio continues to update as well. And I think that finding a version of any imaging platform that will continue to evolve and get better quickly is very important. So doing some research, recognizing, what's the most important to you, where is your workflow, what is that going to be, how does that affect the way you treatment plan, way you case presentation, figuring out what's the most important things, and then jumping on that one, right? That'd probably be my initial advice. So here are some of the AI images that you see. This top one is actually the Overjet version, very similar to that Pearl with the colors, and you can find out a whole bunch of different things. I find them effective, but I don't think they're taking over for what I'm doing. And I'll show a couple cases what I'm talking about. I like it to give me suggestions, and I've been shocked at how well patients are accepting of AI. I know that there was a big thing a couple of years ago when it comes out like, hey, are we going to trust this? Why should we trust a computer to diagnose for our patients? But really, overall it does a good job. And I tell the patients, hey, I'm using this to enhance my treatment planning. And so I just look at it as an adjunct, not as a replacement. And patients have been very receptive. And the other thing is that when it comes to nerve tracing, I used to trace all my nerves in the 3D imaging, like you can see down on this slide down here on the lower right, right? I'd have to click every little part of the nerve and have it map so I could see it. And that was frustrating. I mean, I would do it because I wanted to see it, but mapping it now is pretty standard in a lot of AI imaging platforms. Implant planning is now getting more and more streamlined in AI. I mean, implant planning has grown so much. It's become so much easier, so much better. I can remember how many clicks and how long it was taking to implant plan, but now with AI, it's getting better and better. All right, another poll. Let's see what we got. Oh, let's go one more poll here with AI. I'm curious where everyone's at in using AI on a daily basis. Are you actively using AI in your practice? Are you trialing? Like, are you on a trial basis right now with a couple of different AI tools? You're familiar with them. You haven't pulled the trigger yet. You're not really familiar with them, or not at all. This is the first time, which would be crazy. Okay, let's see what we got. Let's see what we got. Okay. Oh, good. Quite a few of you using it daily. That's great. Some of them are aware, just not using them. All right. That's good. So, yeah, I think it's showing this is essentially what we're seeing in the dental industry, that some people are using it and some people are aware of it, kind of want to use it. Everyone's kind of thinking about how's it going to affect me. All right, let's go into it. So here's an example of how I'm using AI caries detection. This is DTX Studio Clinic, because this is what I'm using primarily in my practice. Uh, so the blue is what comes up as findings, and then you left click to verify a finding with yellow, and you can right click to dismiss a finding. And so here you can see I'm clicking in on my left to say, yep, that's it. This one, I'm like, maybe bone loss. I'm not sure there. Actually, I'm going to take away that one. So you could right click, you can go back and forth. That root canal, I'm like, I don't really think that's a defect. So you're using it to your advantage, but also sometimes it misses it. You can see there on the distal of 4, right? And the mesial 3, I probably would have picked that up. But it does catch it there on the distal of 29. And so I kind of talk about that. And here's an example where it shows in one image and not on the other. So finding it sometimes is great. And I use it kind of to show patients, hey, this is what AI is picking up. One of the other things I like is that you can see images on your right side of extra ones, and then you can start picking them up and seeing them in a couple of different ways all together. I love having multiple images that I can show and compare. And then I can pick on the ones that I think are most prudent. And that annotates it. It will always be in their chart over there. So even for some reason the treatment doesn't get done, the next time the x-rays pull up, those yellow ones will stay, and then you can see them. You can also click on the tooth, and then all of the images of that tooth will come up. And so my 2D image, and then also PAs, you can see. I also want to bring this part up. The idea that, I'll just back up here for a second. So this was actually a cone beam that was sent over by an endodontist. So you can see this is a very small, limited size cone beam. I love the razor sharp crispness of that. But let's say I didn't take a cone beam on that patient and they went to see the endo because I know that they needed to. And so sometimes in transferring images, that can be difficult between imaging platforms. We'll talk about it in a minute. But so if they take one, what's great about this system, and not all systems are the same, but a lot of them are getting there. And I would be looking at this to be able to import other companies. So this is a DICOM file from another provider and another company, and we were able to upload it right there. So yeah, I definitely like, and then you can click on the different teeth and you can get all of the images associated with that tooth. So I clicked on tooth number 2 there, and so it brought up tooth number 2. So that's kind of how I'm using AI, AI to assist in my diagnosis, not to be doing it for me. So that's just a couple of examples. All right, here's one about mapping the inferior alveolar nerve. So this patient here came in, we had a cone beam, and I was looking to see about their wisdom teeth. I'm the one who takes the wisdom teeth out in the office. So I was looking here and I clicked on tooth number 3, but then if you see here, whoa, tooth number 2, you can see this lesion from the buccal, which is wild because you couldn't really see it clinically that well, and radiographically you can't see it that well. But there it's very evident on the cone beam image. So I love this option. This is one reason why I love, let me just pause this for a second, why I love having the 2D and the 3D in the same screen is so that you can see, right, this 2D image, and then all of a sudden as you're looking at it 3D, then you can look back at the 2D being like, okay, oh, okay, maybe I can see it here, but then you can get both views or all views at the same time, which is great. So checking out here, the different teeth, I'm looking here. There's the blue auto AI generated nerve tracing, right? I'm looking to see how close those roots are to the nerve. And what I like about this is that even though sometimes, let me get that back. Sorry. Let me put this going on here. Let me jump back. Even sometimes when I can tell pretty quickly where the nerve canal is, the patients may not be able to tell. And so when I have that blue line up, immediately they know. So when I talk about risks of taking out teeth, they can see it so easily. And whereas 2D images, almost impossible. 3D images, you can kind of see. But look at this one. This is crazy. Sometimes you might be like, oh, the nerve should be close. But when you look a little bit closer in all these different images, yeah, oh, the nerve's right there by that distal root. And then when I look at it in different, oh my goodness, it's going right in between that split root. That's wild. So now I'm recommending a cornectomy, and the patient can understand, oh, especially when I'm looking at this, showing how the nerve wraps right around there as the root splits. So when I'm discussing cornectomies and why I would do a cornectomy here, it makes so much sense, right? And so being able to present that, have the patient recognize it easily, be able to see it, communicate that is just so important in treatment planning, and it makes them understand, okay, this is why they would do a different procedure than another one, possibly. Okay, let's see. Yeah, and so you can see that all together, and you can be diagnosing from any screen there. So even though this patient, I was seeing them for the wisdom tooth removal, you can see that I jumped in and saw the caries and started to diagnose caries at the same time, so we could have that conversation. And I do, like, I love it's already in there, and so now I'm starting to do all of that treatment planning together. Okay, this one here, using 2D and 3D to diagnose, I think is really important, as I've already kind of talked about. Here, the patient came in. This was a patient yesterday. I like to bring in very, very fresh treatment planning. This happened to me yesterday. We already had a bite wing from, you can see, July of last year, but we took the cone beam yesterday. And the probing depth was a little, the tissue was a little inflamed on the buccal of 18. The probing depth had some bleeding. It was seeming like it was going down a little bit, but like almost to a 5. And then I was looking here, trying to look back and looking at the 2D images, like, well, sorry, let me go back to these 2D images. So here's a history. I do love one of the options where you have the 2 little arrows back and forth, and this with different imaging platforms, you can do this a lot of different ways to compare year over year. But this is super easy because they're all AI driven. They always know exactly where they're supposed to be. And so every tooth is able to be compared with its mate over the years. So you can see this is from 2021, 2022, 2024, 2025. You can see these images and you're like, well, maybe in 2024. But then once I took that cone beam and I jumped over there to that tooth, bringing up the 2D and the 3D images, oh, you can see pretty clearly in every 3D image that there is some focal bone loss right there. And so being able to see this with the patient, describe it, sometimes if you want to just enlarge one screen, you can, or you can double click it and make that one bigger. However you want to do it, it's up to you. But having 2D and 3D at the same time makes it so easy. This is when I'm in hygiene, easily talking to a patient about some routine treatment that they're going to need. And this explains it very, very easily. All right. What we got next? Oh, I wanted to show again a little bit more of sharing DICOM files. So we work with a lot of different specialists. So first, I'm going to stop real quick. Sorry, all these videos are great. Oh, here we go. Hold on. So you can see all of these images were actually taken by another provider. And sometimes I've had issues in the past getting 2D images just to populate my imaging system. So as you're looking for different options that are out there, make sure you see something that is compatible with you can drag and drop. So that's one of my favorite things. You can drag and drop right into the imaging system and it will populate it. So here are the 2D images from another provider. And then this is a cone beam from another provider. So all of these images that I have on a new patient actually were already populated before the patient came in with images from other providers, if that's not crazy enough. Because you know how hard it is to get those from other providers. And like with your imaging system, sometimes it's just not worth it. I can remember for years, I would just like, I'm not even gonna request them from other providers. I'd rather just not even charge you because it's so difficult to get them into my system. I don't know if any of you felt that way, but I felt that way. But with this imaging platform that I'm using, it's so easy to do. So I'd be very mindful as you're looking at different options to see if you can drag and drop files, import them easily. So here's a great image from another DICOM file where you can see that bone loss on the distal of number 31, the tooth that has to come out. And so we actually just took those images and we implant planned right into the other DICOM file. So we just used it right there and we recognized, yep, hey, we're going to be able to do this. The patient was coming to us. They knew the tooth needed to be extracted. She was nervous. She wanted to talk about sedation. Am I going to be able to place the implant at the same time? And we're like, well, let's find it out right now. Real time, we planned it with her in the chair. And then we were able to actually get that surgery done. So we did it real time. And then we were able to remove the tooth, place the implant, do the bone graft, and get it done all at once. So this was great to be able to use all software from different providers, get the treatment, get her in, get the treatment that she wants done right away. And I think that's sometimes one of the most important things about treatment planning is, I don't know if it's being opportunistic or when the patient is ready, that you're ready and you can communicate what you need to communicate in a timely fashion. So I think that's really important. Okay. Let's get the next one. Oh, this used to be super difficult. This used to be so hard. Getting virtual teeth. Not every AI planning can do this. So I love being able to drag and drop cone beams. I'm sorry, not cone beams, my intraoral scans onto my cone beams. So this is a patient. Let me just pause here for a second. Let's go again. All right. So let me show you, spoiler alert, the implant's already placed. But let me show you, the patient came in, had a peg lateral on number 10, congenitally missing lateral number 7, had gone through ortho and was getting ready, needed to be sedated for the procedure, also wanted to get his wisdom teeth out and get the implant placed all at the same time. Implant placement, especially on congenitally missing laterals, when that space is so dang small, is really difficult. And all of you who have restored lateral implants or anterior implants, if that angulation isn't spot on, man, it is very difficult prosthetically to get that done. Oh, all right. So I imported the intraoral scan that we took and I overlaid that with my 3D image. I'm going to show you how to do that here in just a second. And I'm going to show you how I treatment plan this implant. All right. So I just hit plan, add implant, draw it where I want to. It self-populates with your implant library that you're normally using. So if there's an implant library that you like, you can import it. And again, making sure that the software that you're using has that ability where you can bring in all the different implant companies is really key. So this one planned the one that I wanted, got the right size, a 3.0, which is really tight. But here is where I want to show you how you can do virtual teeth. So in the intraoral scan, you can just hit that little button up there where it says, if you look up at the top, intraoral scan setup fused with 3D X-ray. You can just click that button, or you can add or remove teeth. And then you just hit that button and AI automatically will find the tooth that it's missing and start counting, making sure that it's right. You just say, yep, those are all the teeth numbers. And then this is a real time. This is actually how long it takes. So this part I wasn't going to speed up so you could see how long it actually takes to create that tooth before I'm even done talking. And so you can have the tooth, the root, you can have the tissue on there as well. So you can see, and it does a great job. The AI functionality is getting better and better of making a tooth that fits that, the layout and the size and the shape of the teeth. So AI is getting better and better at giving the correct sizes. I mean, you can make adjustments to it, but it's getting better. So you can see here, I have the root there if you want to take out the root, but you're still looking at the emergence profile of the implant. Am I going to be able to do a screw retain? What's my access hole look like? Can I change the angulation? Is there enough room to see if I can get it just right? So I like planning this, even if you're not placing the implants. I like to show the patient. You're often the one talking about the implant placement. So understanding what's possible, giving the patient, what's possible and giving them realistic expectations is really important. And if you are the one planning it, you can also go all the way through. This is one we did here. We did a full custom surgical guide that we printed with our 3D printer, and we had the sleeve, and we were able to do it without sending anything outside. We didn't have to send it to a lab or anything. We were able to get it done, and then you can see we were able to place that implant, super tight space, but with the guide and everything else, we were able to get it just right. So very helpful in planning of your implants. All right, I'm going to keep going, and then if we want to jump back into some of these questions, we can talk about it a little bit more. Okay, I'm going to get more and more complex as we go along. I want to show you when you're planning really big cases that span a lot of time and both are cosmetic and surgical, that there are components that are very, very important, and you can utilize this imaging platform in a number of different ways. I first wanted to show you how I'm using it for in my cosmetic photo series. So these are the photos that I'm normally taking. I take headshots in the studio that I have behind me. I only have had the studio for less than a year. I used to just take all things with a black background draped over a door in the hallway, but it was really important to get the full face photos. So you can see I have my full face photos and all the angles that I want. And then I have my pictures of the smile from all the different angles presented in a way that the patient understands intuitively, right? They can see themselves right away. They understand, they're making judgments about their own teeth and what they see even before you say anything. So having a layout like this, and you can change up here where it says clinical pictures, you can change that layout to whatever one you want. There are a lot of different options. So this is how I have it with my extraoral, my full face photography, my extraoral smiling photography, and then my intraoral with my really nice camera, right? So I collect all of those. I wanted to show you, if you double click on an image, that you can bring those up together, and they also have all the images on the right side, so you can also select those, and they're always there by date. So here are some of the first ones on the same date. But if I'm wanting to show this one and I'm doing a before and after, I can show her where she was at and where she's at with the progress. I can show you where she was at This was mid-treatment, and then this is further along the treatment. So we had this from very initial, right? And then we had mid-treatment, and then we have further along as we were getting to the veneers. So you can do it side by side. It's so easy to do. One of the things that was most frustrating to me was pulling up little Windows Explorer windows, right? Trying to get them side by side, the same image, the same size, and doing that. I mean, I've been doing, I did that for years and years. But now having an option where I can just click and they're the same size and they are balanced and easy to share to the patient. The patient's already making those judgments in their head of what they want to change. You can show up close, right? And you can select the images. I wanted to show you this case where it started. It was kind of a crazy case. This patient, she was on an electric scooter, like a Lime scooter, and she fell and she had broke her jaw. You can see all of the hardware that's in there, broke some teeth, had to lose some teeth. So we were in it for the long haul. I mean, we had a lot to correct. So planning that, seeing where we came from. So what I wanted to show you was this part where it created a virtual tooth. So I went through the virtual tooth, and what's interesting, it counted on the right side, she is missing a premolar, and on the left side, she's missing a premolar. Now, I brought this in for an example because I've already had the implants placed, but you can see, well, we're struggling to determine what were we going to do here with this. Will we do one tooth or two teeth? And I actually think the AI did probably a really good job in determining the proper size of that. Now, I wanted to be a little bit higher, so you can change it a little bit so you can see for implant placement, and buccolingually, you could change that. So like I talked about with the virtual teeth. But let's say, here it is again, playing with the virtual teeth, getting it to come on a proper placement outside. So the forces are all going to be correct when you're placing that implant and when you're restoring the implant, right? But let's say we wanted to do two teeth here. So I imported actually the wax up, and this is how you import a PLY file or an STL file from your lab. So the lab sent me an STL file, and I just took that STL file and I uploaded it just like this right into my imaging system. This is how long it takes. You click next, it fuses it. Click, click. And so it's running it, fuses. You don't have to click the points at all. You just verify that it's exactly where it's supposed to be. Now, the reason why I did this one is because I actually had him wax up two teeth in that area where on the right side, she only has one tooth, but on the left side, there's a little bit of excess space. So it's a very, very difficult case. And so you can see that I actually have now this wax up in there that I imported, this red line here, this wax up, and you can toggle on and off which ones you want to see. And now I can start planning my implants so that they go through the proper position, access hole, all of that. And we were then able to place those implants correctly, get them where they needed to be, having them come out. And in the end, we were able to, place the implants just where we wanted them due to the fact that we were able to plan them just right in a very, very complex case. All right. I want to show this case. This case came in last week. Again, I'm trying to show things that are very relevant, pertinent. So this patient came in, and I wanted to show you kind of before and after. So he actually had been searching. He had only been going to specialists. He had gone to a prosthodontist. He had gone to a periodontist, and he was looking for a doctor that had, you guys, he used AI and found out that I was a high-tech dentist. Crazy, I know, but I was high in cosmetics and I was high in tech. And so he was actually using AI to find me, and this is kind of what he wanted, and he was thrilled with the presentation that I gave him. So I did a wax up for him. He came in, we got 2D images, we got 3D images, we got a scan, we did a wax up, and he came back for a mock-up. And on that same day that he did a mock-up, I was able to put these images up and then talk about what are we going to do for the treatment. So I will tell you that I talked to him initially because he wasn't sure, am I going to do 4 teeth? Am I going to do 10 teeth? I'm not quite sure. And so I wanted to give him the option of both 4 and 10. Now I know you can do digital wax ups. I personally think if there's one thing you're going to do analog, it's going to be a mock-up analog because they can see it in their face in front of a mirror. They can really get a real feel of what that is. So I gave him the option of doing either or, and then we mocked it up. And then I was able to show him before and afters. I just drag and dropped all the files, right? I took the photos, and once I uploaded those images, I dragged and dropped them right into the imaging platform. And then we just went through every image. Okay, this is what it looks like. This is what the potential could be. Here is the mock-up. Here's where you were at. He was wanting a little more full smile. He felt like his front 2 teeth were a little kind of rabbit, a little buck. And so he wanted a little more uniform. And again, the mock-up isn't amazing, but it gives him the information that he needs to make the decision. And I think that's what your imaging platform needs to do for you. Can you utilize the information that you have so that the patient is the one making the decision with almost nothing you talking, right? This imaging platform needs to be so seamless and so easy to use that the patient's like, oh yeah, I get it now. So we went from this image, then to the other side. We were able to talk about the differences, how retruded that lateral was. He had talked about wanting it to be a little bit more forward. We could show him the comparison really easily. And then we started to talk about the big treatment plan with 10 teeth, where it was going to be. And when we took the 3D image, in the 2D image, we saw this. And then when we took the 3D image, we saw that this was an issue as well, right? It picked it up with the AI. Yes, there's there's a side lesion there, apical lesion, but it's on the distal aspect of that mesial root. So I ended up sending him to the endodontist to get that other root canal treated and to verify if that tooth was salvageable, wasn't salvageable. So at that same time, we were able to just go ahead and treatment plan the implant that we were going to be doing in the future for that case. So whatever he needed, we were able to do it right when he needed it. All right. So that was another big case. So stoked that happened last week. So glad we were able to do what he needed for it. Okay. Another case, that case was on Tuesday. This case was on Thursday. I like to just bring in, this is real world, everybody. This is what I'm doing all the time. This case just happened on Thursday. I just wanted to show you the patient came in. She was coming in to me for cosmetics and for surgery. She knew that we did both. She had seen some other friends, and she was worried about this bridge that she had done years ago, and she was wondering what her options were. So taking the set of clinical photography, taking the 2D, the 3D image, and importing 2D images and getting an intraoral scan, then we were able to show her, right? Talk to her about the things. One picture of her smiling, one of her full face. I love to use this. Oh my goodness, this image right here. Let me just stop for a second. How powerful is this? I love to talk to my patients about how important it is that they recognize that most people are not talking to them straight on, right? That they're talking to them in this social setting, and to be able to show the picture of the teeth and then the picture of them and say, what do you see? I don't tell them until they ask me. I'm like, or I'll ask them, do you want me to give you my take? But normally I'll ask them first, what do you see? Does anything bother you? Is everything fine? Trying to feel them out, see where they're at, and then you can get a sense of where they're at, and then they start to tell you what they think. And then you can add from there. But these images where it's the patient's full face with the teeth and the smile, I mean, it's so, so powerful. And being able to navigate through it easily is really, really important when you're trying to navigate this case. Now, I wanted to talk about this area here. She was curious about whether or not we could put implants in 8 and 9. And so I did the implant planning, right? I imported that intraoral scan, but then you can see how tight her the nasopalatal foramen is here, and where the bone loss had occurred because it had been so many years since she had lost those 2 teeth. having these images were so easy to be able to describe why we were struggling to be like, well, can we place them right now? Or do you need to go get a bone graft first? Maybe we're going to incorporate a periodontist if we need to get a bone graft here, soft tissue grafting. So we were able to place these two and just have a discussion about it. We ended up actually referring her out to two specialists to get some opinions from them, but we were able to first talk through it to understand what the process was going to be like. And then this image was really important when I went back to the intraoral scan in the software to show her the loss of volume of the tissue and how important it was going to be to get that volume back to make things aesthetically look correct again. And so being able to rotate these images, go back and forth between the 2D and the 3D, the 3D and the intraoral scan was so important to be able to treatment plan that with her so she could make a real-time decision with us of what we needed to do. And so she's moving forward with that treatment. So that was a really, really powerful case. Okay. Now we're coming to the end here. I want to do this quick poll and then we'll go to the Q&A. So in this decision tree that you're thinking about, what area of imaging would you most improve your treatment plan and outcome? After talking through all of this, seeing what we have talked about, where do you think you want to improve upon? I'm just curious where you're thinking. Is it seeing all the images on this one screen? Is it having better visuals? Is it just being more confident, streamlining your workflow efficiency? Maybe it's having your team. What do you guys think? What's one area do you think you'd like to improve on? All right, let's see that. Yeah, seeing all the images on one screen, right? I mean, it's so dang important. I'm with you. I'm with you. And then, yeah, getting the visuals is so important. So thanks so much for that poll. I think, what is that decision tree? What's your workflow? What's most important to you? And then doing the research to make sure whatever imaging platform you're going to use can do all the things that you want, right? And I wouldn't buy unless you're for sure. Because once you really get into an imaging platform, you are going to be married to it for a long time. So making sure it has all the AI features that you have, the 2D, the 3D, the intraoral scan, being able to drag and drop, open architecture, right? Whatever's most important to you in your workflow, make sure you get that. And then I promise you're going to be happier with your decision. Okay, here's my contact info. Please email me if you have questions. You can DM me on Instagram. You can follow me on Instagram. I do a lot of cosmetic stuff mostly, but if you're curious, and I DM with a lot of different dentists about stuff and questions that they have and anything I can help with, I'm always open to it. So let's see if I can do some Q&A here. All right, throw up the questions. Oh man, gosh, I wish I had the answer to this one. Someone asked, what AI companies do I have for automation for consultations and notes? Now, I have been doing so much research on this. I just started to use Bola AI for my charting. So my hygiene team is using Bola AI, and that's been good. And they have a note section also that I'm excited about trying out. So I'm just in the part of trying to get that where you have a microphone. This is what it looks like. Just a little mic. I'll turn the red side so you can see it's about that big, and you can just have it right there. And so, and you can use just your phone. So that works out. You can use your phone, or it can be on the desktop, and it links to the desktop. And so you can do that. So that's coming. It's getting better and better. I'm sure within the next 2 years, we are going to have really good AI options for notes and consultations, because with consultations, that's where I'm using it. I want to use it the most. All right. Another one is talking about DTX Studio. The diagnostic images and findings, I don't know if it's a separate subscription. You need to reach out. I've had it for a really long time, so I think I've just been paying for it forever. So it may be the next version, but opening that up, the AI for what's there is definitely worth it. I love being able to have it. It is definitely not very cost prohibitive. I'll tell you that much with what I'm doing. I don't even think about it. So it's really, really good. Okay. Other questions that are out there. All right. Hey, someone told me this. I did not know this. Overjet bought Dental B and is now called Overjet Voice. It's amazing AI charting and notes. That's good to know. Right now, I'm testing out Overjet for insurance verification. So I may be I may be doing that. So we'll see. Thank you. The sensors I'm using are my Dexis Titanium. Those are great sensors. I love them, and they're in my ecosystem. They're in my workflow. I do think getting a workflow is really important. Once you decide which one is good, then you keep on doing that. So yeah, hit me up, DM me.